Hello, everyone. This presentation will cover understanding the 2014 Affordable Care Act and the impact to dental offices with less than 50 employees. Hi, I'm Kerry Smith. I'm principal partner at Dentist Secure. Before we get started here, a couple of housekeeping items. I just want you to know that all the information that we are about to present here was pulled from training classes and from government-sponsored websites that have volumes of information about the Affordable Care Act and the changes that will take place in 2014. We recommend you review these websites in detail if you're interested in very specific situations, and please do not use any of the information contained within this presentation as a decision-making tool for your particular situation, okay? Everything is a little bit fluid as far as the products go that'll come from the carriers. So the assumptions that we are making here in this presentation and the information we're giving you is based on the laws that have been passed and early guidance that the insurance companies are giving us. Okay. About us, hey, again, my name is Kerry Smith. We work with dentists, and we work with a lot of them. We do every line of health insurance that's out there for small group and for individuals. We also handle malpractice, business insurance, disability life, home and auto. We also do startup consulting for new practices that need help. We serve primarily the Texas market. We do have clients outside of the state and are more than welcome to help folks that are close by that need the help. We're a member of the American Society of Healthcare Risk Management, and we are a PACE AGD CE provider, amongst a bunch of other things. We currently have a little more than 50 carriers we work with, so I'm confident there's not too many things we can't handle right now. The specifically about this conversation, we have some carriers here that are the logos of the ones we represent, amongst others. But I want you to know that we've been doing this for a while, and we currently have a little more than 250 clients that seek our guidance for such related issues as healthcare and the changes that are going to occur here coming up shortly. The latest that we know, another slide just to reiterate the point that this is very fluid. It's similar to reading a book as it's being written. And the best source of information is to call us direct or call your local broker that should be well aware of these situations of what's the current situation is, rather. Or you can go to the many websites. There's one listed here from the Department of Labor that's been very helpful in determining exactly what's fact versus fiction. And then at the end of the presentation, I give you some links as well that you can go and review on your own. Okay. The Department of Labor, if you don't think this is complicated or confusing, there are currently, as it stands today, 15 pages of FAQs, or frequently asked questions, found on the site. I found that a little bit humorous that I'm going to talk about a subject that requires that many FAQs because we don't have all day. So anyway, let's jump into this. I want to get through the high points and hopefully open the door for an invitation for you to call us. Okay. The 2014 mandates for small employers with less than 50 employees do not change many of the mechanics that are currently in place for small group health plans. So don't panic. The whole thing isn't completely revamped as far as eligibilities and those types of items. But there are some key things that I want you to know. And the big one here, and this is a huge misconception on the various dental boards and what have you that are out there, is that you have to buy insurance as an employer. Well, if you're under 50 employees, there's no mandate that says you have to buy health insurance for your employees. There is the mandate that all Americans will have some form of health care coverage. And if you don't get it through your employer, you get it through the individual markets. And I have another webinar that's been recorded for that. You can click on the YouTube channel and find that video there that explains the individual markets. But I want you to make sure that if you do not, make sure you understand that if you make a decision to not provide healthcare insurance, if you currently do not, that your employees will have to go through a specific process to get enrolled, and that experience we can help you with. But I also make sure there is a mandate for them to comply as well. There is another compliance issue here that even though you do not have to offer healthcare plans, you still must provide some communications to your client or to your patients, excuse me, to to your employees about the existence of healthcare marketplaces and the fact that you do or do not provide healthcare coverage. I got stumped there a little bit because we have some questions coming in on the chat channel on the side. So I'd like to ask that we will record those and get back to you on a personal matter. At the end of the presentation, we shall have a short Q&A session to boot. So I was doing two things at once, trying to read a question and do the presentation. So I apologize for that. We want you to also know that as far as compliance goes, that if you have an existing plan that's been in force prior to March 31st, 2010, the carriers will release new products and your current plan may be impacted with respect to coverage features and the essential healthcare benefits that I'll discuss here in a minute. So be aware of that. If you want to know more, I'm going to have links on practically every page for information here. And this is just information I've kind of pulled out of the information stream that I thought was relevant for dentists, dental offices, and your staff. One of the main changes is within this page is the elimination of pre-existing health conditions. There's also a cool feature that the healthcare company cannot, they're required to reissue the health plan to anybody without medical underwriting. And they cannot increase the premiums at renewal for existing customers because they've incurred claims or experienced worsening health during a policy year. Huge, because currently in 2013 and previous to that, healthcare companies were able to make rate adjustments based on these items here, amongst others. So that's pretty big. And then the last one, that kind of goes without saying, you're going to get terminated if you don't pay your premiums or if you lie on your applications and it's found out you did. The Affordable Care Act establishes a set of essential coverages, and there are 10 of them. And on these, they were either on group plans previously, they were either addressed to a degree, excluded outright, or maybe just very limited in coverage. And I want to just give you this list and say that with the the Affordable Care Act changes that are rolling out in 2014, this essential coverage package will be on every policy and should be addressed by the carriers once they roll out, the insurance companies once they roll out our products. These are the same essential coverages as individuals' policies as well. So the Affordable Care Act, what it effectively does is very much brings in line individual health plans with small group plans and in terms of coverage. So there's not a big difference there. And here's the list. The big ones being maternity and newborn care, that was covered under group plans. Mental health and substance abuse was sometimes excluded. And then we go on a list. And one of the things that I wanted to point out here was that the pediatric services, including dental and vision, will be included on group plans. So that may or may impact situations where patients did, or people that did not have insurance need that kind of coverage for their children. It will not cover adult dental or adult vision. You'll have to seek a separate vision and dental plan for that, and we can help you with that if you need. The way they're going to, there's a feature in the Affordable Care Act with this metal plan. They call it levels of generosity. Is when you select a plan, it's going to fall into one of these four categories of bronze, silver, gold, and platinum. And as an example of what this means is the actuarial value applies to any covered essential health benefit expenses. So if you have 80% of actuarial value and you buy a gold plan, the gold plan will pay 80% of the covered essential benefits, and then the remaining 20% will be paid through deductibles, copay, and coinsurance. Now this applies to the essential health coverages here. So that's what these are. And this will allow consumers, the neat thing about these metal plans is it allows consumers to compare carrier A with carrier B having the same bronze or silver or gold level of coverage. Right now, currently, each carrier may offer upwards of 20 different options. And so it's very difficult to compare Plan A from Blue Cross Blue Shield with Plan B from Humana when you have so many different options. And this really helps to bring some consistency across, what are these healthcare policies actually covering and how do they cover it when you switch between carrier and carrier. The Affordable Care Act establishes a marketplace called SHOP. It's an acronym that basically is the channel for which employers under the under 50 employees will use to purchase healthcare. Now, it is a website that you enroll on, and it will help you determine any eligibility requirements. But I want you to know that the role of the advisor, the producer, or broker, that's what we do, is there's two routes to purchase. You can go direct to the government's website and apply by yourself and go through that process, or you can use our services to help guide you through that program and help you enroll and help answer your questions and do those things, kind of as a high touch service. And uh, with that, you will get an assigned agent. Basically, you'll tag to us, and we'll be able to help you make changes and help you through those programs. Okay. One thing I want to point out is in Texas, we don't have a state marketplace established, so everyone that lives in Texas can go through a federally managed site for SHOP. Okay. To qualify for the SHOP, these are the qualifications that they've put in place. You have to be located in the service area, which we are. You have to offer the coverage to full-time employees. You have to have at least one eligible employee on the payroll, not a sole proprietor, like a one-person company that's the owner and the sole proprietor. That would go to the individual markets. You have to have 50 or fewer full-time equivalent employees. And while the federally facilitated SHOP can determine eligibility using the definitions above, if you do access this through a state marketplace, there may be some different rules there. So, but not here in Texas so far. Enrollment. There's 9 steps to it, but I'm going to break it down for you pretty simply. You're going to go to the website. You're going to create an ID and a password, and that'll register you there. And then you'll check your eligibility to make sure you can use the site. And then from there, you'll define how much you will contribute to the plan for each employee. And the minimum is 50%, as it is today in a small group market. But you'll be able to determine how much you want to contribute there. And then you can also decide whether all the employees pay the same premium, or do we distinguish or separate the premium payments based on your age. And when I talked about previously the pre-existing conditions being eliminated from the underwriting criteria, age is one that will stay and will impact rates. So you can decide, if you have a population of people that vary in age, you could assign an age-based premium payment program. Okay, that's pretty cool. To some people, I guess I should make an editorial on it, but I think that's a nice feature to be able to decide which way you want to go. And then once you've decided what your choices are as far as the plan goes, then we as brokers can help you through the process of enrollment. And that will include both the enrollment for the employer as well as the enrollment for all of your employees. Here's some rules around enrollment. You got to give them the first month's premium. In 2014, the premium is going to go direct to the policy insurance company, which indicates that at some point in the future, the premium payments will be made through likely the IRS, which is one of the entities that will monitor compliance with the overall Affordable Care Act. The employees will also have a website they can log into and create their own user ID and password and enroll in the plan that you select as the employer. And my job here, as we are a federally facilitated or federally certified facilitator, and we have a unique ID that we can help you with the process, and we'll be designated as your advisor as we go through the program. There are 12 enrollment cycles per year, and I want to tell you that the open enrollment for companies that do not have a group plan in place or wish to establish a new plan begins October 1st of 2014 and runs on through to January 1st, which would be the first effective date for the plans. Now, if you have a current plan in place, there's some rules around grandfathering that you need to be aware of, and I'll give you the link to the webpage that explains that in gross detail. So I want you to know that the enrollment periods will begin in October, so we'll see a ton of information come out at that point in time, and then everybody will want to start studying these materials to find out what they need to do. If you miss the open enrollment period, there are special enrollment periods, just like we have for small group today, And here are some of those special situations where people can enroll out of the open enrollment period. And it basically ties to you're gaining a dependent, you're losing coverage through a group plan or through another group plan, and you need to enroll in coverage out of cycle. There's also, if you lose coverage from Medicaid or CHIP or one of the government-sponsored healthcare plans, if you lose coverage from there or fail to qualify, then that would be a special enrollment case. And then also, if you move to another jurisdiction that has different plans available, maybe you move from a non-state sponsored state to a state-sponsored state where the state runs its own program, then you would then qualify for special enrollment. There are two other ones I wanted to ferret out and show you about that come up: is adoption and marriage. In both cases, you need to notify the website that you've either adopted. Well, in some cases, my wife thought I got adopted when she married me, but when you acquire a child through adoption or through marriage, as my wife would say, you need to notify SHOP within 30 days that event has occurred. And if you miss that 30-day deadline, then you can't enroll that dependent on the group plan until the next actual open enrollment period. So what that means is you end up having to go to the individual market for that coverage. Okay, you will have to prove through the IRS that everybody in your family has credible insurance coverage, and that is what will happen in this particular situation. Okay. On the marriage, just to point out at the very bottom here, it says that if you do qualify for the special enrollment in marriage, you can either create a new plan together or you can add the spouse to an existing plan that you're on, and that's really without waiting for an annual enrollment. So, under Affordable Care Act, the premiums will be calculated a little bit differently than they are now. And what I want you to know is that this is the requirements for the premium calculation for individuals in the plan. They're going to be they're going to be calculated based on age, location, and tobacco use. Currently, medical history plays into that, and therefore the carriers are now not able to use those data points to rate policies on. So they're going to be using this. So that's not saying that the premiums will be less expensive, but knowing that your previous health history cannot be used to calculate premiums will allow the carriers to accept pretty much everybody and then price their products based on these criteria. The families will be a family premium on a group plan will be just the sum of the premiums attributable to each family member. And then the group premiums are then built up from all the members in the group, and each group's rates will be based on the individual rates of its members. So, and if you remember previously on the slide there, that instead of having everyone pay equally across the group, you can set it up to where people who are older pay more for their coverage, because that's how the premiums actually calculated. Tax credits. Before I say another word on tax credits, go to irs.gov and dig into the tax credits for the Affordable Care Act provisions. Also, consult your CPA about your particular situation. So I'm not a CPA, and I don't promote to give tax advice in any form or fashion. This is just pulled directly off the IRS's website. So please consult your CPA. And this is just a piece of the overall piece, but I wanted to pull it out and show you what it looked like. So moving forward in 2014, if you're eligible to purchase group insurance through the shop, you may be eligible for a small business tax credit that would contribute 50% of the employer's contribution of the employee's premiums toward the insurance premiums. Gee whiz, that was a lot. So basically half of whatever you contribute to the employee, you may be able to qualify for a tax credit to recover that through your income tax reporting process. Small business health care, to qualify for the tax qualifications under the small business part of it, you have to have at least less than 25 employees. The average wage must be less than 50,000, and the percentage that you'll get, you must be contributing at least 50% of the employee's premiums to the employee's health insurance plan, and you have to buy the plan through the shop to get the tax credits applied through the Affordable Care Act. One thing that the Affordable Care Act does not change is COBRA. You're still going to, one thing I want to note is that the shops will not notify employees about COBRA if they terminate employment. So it's still the employer's responsibility to notify employees of COBRA. And you'll still be responsible for extending health care through COBRA. And then COBRA employees will appear on your invoice for your policy, and it's your responsibility to collect the COBRA premiums from the terminated employees. Of course, if they quit paying those premiums, then you can terminate them from the policy. They have to enroll within 60 days after losing group health care coverage. If they miss that, then they're going to have to go to the individual marketplace. And what we've been told, of course, we haven't seen the ultimate prices yet, but what we've been told is that sometimes the prices will be cheap, less expensive if you go to the individual marketplace versus Cobra. So something to think about when you do terminate employees. Um, one note I mentioned at the beginning of the presentation, even though you're not required to offer healthcare insurance as a small group under 50, you are required to provide notice to your employees about marketplaces and about the existence of a group plan within your practice. And there are two forms. We can provide those to you. They are one for someone that does provide group and one for someone that doesn't. And you'll need to notify everybody beginning October 31st. I recommend you do it now so it's not a shocker at the end of the year with holidays and whatnot. So do that now. And if you need more information, you can call us at the number at the top of the screen, or you can go to the Department of Labor's website and look under the heading called Notice to Employees of Coverage Options. Grandfathered plans, if you have an existing plan in place, there will be a process by which you will continue that policy, but at some point the carriers will move to a new Affordable Care Act compliant plan. Not knowing your particular situation, I advise you to go to healthcare.gov and click on this link, or go to this URL. What if I have a grandfathered health plan? And it'll explain to you the details and the processes there. What this middle part tells you is that, look, these are the essential healthcare coverages that are changing versus what the old plans versus what are the new ones coming out. So be aware that some grandfather plans will be impacted, and you need to know if you have an existing plan in place how that will work. So how do we work with you? So we're a federally certified healthcare broker, and our job is to assist you and your family and your employees through the selection and enrollment and application process. The insurance companies pay us for that work. There's no price difference or product difference between the programs that you select through us or that you get through the government shop marketplace. So the advantage to you is you get someone who works with this every day to help you through the process versus going direct with the government. Not saying going direct's a bad thing. I'm just saying that with 15 pages of FAQs on the Department of Labor's website, it might be a good idea to seek professional help as you're going through this process. The last question we get, and this pops up almost after every presentation we do, is can you come to my dental society or my study group and speak to us one-on-one about these changes? And the answer is yes, and we're scheduling those now. If you have a group of professional contacts or your dental society or your study group and need to get everyone in the room, and I find that these in-person presentations are much more engaging relative to the Q&A that happens because everybody has the same questions, and it's good to get that dialogue going. We are also at the end, we are a PACE AGD CE provider, so we can provide CE credits for any programs that we're involved in. Resources. Click away to your heart's desire. There are so many websites available. Some of the good ones, this is our website, dentistsecure.com. That's about us and all the things we do with our phone number. If you have personal questions or need help and you don't want to sort through all the pages of stuff, just give us a call and we'll be glad to help you. You can go to healthcare.gov. That's going to be the website for the main exchange for the federal government. And then down here are some other ones. One's from Blue Cross Blue Shield, one's from the Department of Labor. And one of the ones that I found was absolutely very well done. They put a lot of money into this website. Is this Kaiser Permanente website? It is a good guide, something that you should review and explain. So it helps explain all the details and changes that are coming out. This webinar is recorded and will be presented on YouTube. So if you find this on YouTube and you found it valuable, please rate it, give us a comment, and subscribe to our channel. We have a lot more videos coming out around this topic and others. And then lastly, I just want to leave this with you. This is a really high level overview of a lot of material that is quite complex in nature. So please don't consider or make decisions based solely on this presentation. There's a lot of information out there. I want you to study it and really understand it to be able to make an informed decision. If you find that you can't communicate that or know all the facts to your employees and how it will impact them, please call us. We can help you through those talking points. And in a lot of cases, we present these changes directly in offices to help everybody understand what is exactly going on. Please read that. And with that, that's the conclusion of the dental office with less than 50 employees and the impact from the 2014 Affordable Care Act. Thank you so much for your time. Again, my name is Kerry Smith, Principal Partner at Dentist Secure.